Kayla, can you hear me?
Yep.
Yeah, okay. So I just have to wait for Emily here. Um, did you get a chance to listen to the lectures on Monday and Wednesday yet?
I did. I still have like half of Wednesday's lecture to listen to, but I listened to Mondays and then I listened to last Friday's too. So I got through like whatever you had started on the circulatory system that day.
Okay, okay. I am gonna guess you've dealt with the heart before, you know something about it.
Mm-hmm.
We talked on Wednesday about heart sounds, and
Okay.
I don't know if you're very familiar that when I started talking about heart sounds, people kind of perked up like they hadn't heard that before.
Mm-hmm.
So
Yeah,
I don't know what people haven't heard. So
that makes sense.
that's
Yeah,
a
I
part
think
that,
as I was listening to it, it was familiar from the lab because we had to watch a video about that kind of. And about like the first sound is like the atrium contracting, and then there's like the ventricles contract, but they're like a little bit spaced out from each other.
the sounds come from the valves, the
Oh yeah,
closing of the
yeah.
valves,
Mm-hmm.
not the actual wall.
Oh yeah, that's right. I do
That's the
remember
valve.
that.
It's the valve shutting.
Yeah.
Um, there is a sound sometimes called S3
Mm-hmm.
that if you have a really well conditioned athlete, sometimes the um, blood, as it rushes past the contracting ventricle wall,
Mm-hmm.
that rushing sound makes an S3 sound.
Interesting.
You also hear that sometimes in kids, really young kids, because the
Mm-hmm.
walls of the ventricle are thin,
Okay.
and the ventricles, when they contract, they vibrate.
Yeah.
That is not, that is called a Sills
Okay.
murmur. It's completely
Yeah.
normal. They outgrow it usually.
Mm-hmm.
In older people, it's a means of concern
Okay.
because it means that the heart's starting to enlarge, and
Mm-hmm.
so now it has to really contract extra hard to be
Okay.
able to eject the blood,
Mm-hmm.
and that contraction sometimes double clutches, so you get an extra sound, and that is
Okay.
a indication of cardiomyopathy in
Okay.
an older patient. So, like if say for example, say you were a well-tuned athlete, say you ran several miles every day and
Mm-hmm.
could do it very quickly. If we heard an S3 in your heart,
Mm-hmm.
the doctor would hear that and go, "Yeah, so what?"
Okay.
Um, unless you had rheumatic heart as a kid,
Mm-hmm.
then that might be an issue, in which case it'd be in your medical history.
Yeah.
But if it was in a 65-year-old with a history of hypertension, it'd be
Mm-hmm.
another story.
Okay.
So,
Interesting.
yeah.
And you said that's the sound of like um the blood against like the ventricle wall.
Yeah.
Okay, gotcha.
Then murmurs, there's several different types of murmurs. They're so-called systolic murmurs and
Mm-hmm.
diastolic murmurs. If they occur between S1 and S2, they're systolic murmur,
Okay.
and there's several types of those.
Mm-hmm.
Those tend to be clicks. You hear them as a click
Mm-hmm.
almost, and they also have a um, some have it's called the crescendo decrescendo murmur because you get loud and get soft.
Mm-hmm.
Um, That's usually due to stenosis.
Mm-hmm.
Um, there's several different types of murmurs. There's a
Yeah.
website you can go to from the University of Washington
Oh,
that
okay.
has murmurs. You can actually has recordings of them.
Oh, okay.
You can listen to them. It takes at some of them. You listen to them. The differences are very subtle. You
Mm-hmm.
could tell something's not normal.
Okay.
I have that link. I could put it on the Blackboard site if
Yeah,
you're interested.
that'd be
Um,
cool.
yeah, murmurs are something when you're doing cardiac rehab. Usually, you'll be told if
Mm-hmm.
someone has a murmur,
Okay.
but you may not.
Mm-hmm.
You may be the one to detect it.
Gotcha.
So,
Mm-hmm.
because some murmurs can be very subtle,
Mm-hmm.
you only really see them if the person starts to exercise.
Gotcha. And can you only like hear a murmur, or does it show up on an EKG at all?
Um, some murmurs will have EKG profiles that
Mm-hmm.
you'll see. Others won't, and you only really hear them.
Yeah.
My dad, for example, my dad had diphtheria when he
Mm-hmm.
was very, very young, and it stained his teeth because
Okay.
his fever went up really high.
Interesting.
And dad had these little brown, awful teeth.
Mm-hmm.
Um, Dad had a murmur. It never bothered him.
Okay.
Um, he invited me once to listen to his heart,
Mm-hmm.
to hear it. And instead of, um, it was almost
Oh,
like
okay.
that.
Interesting. Yeah.
And there were times when you didn't hear it. It would just
Uh-huh.
be
Yeah.
when dad was a small person.
Mm-hmm.
My dad was only 5'9", 5'8", and then he shrunk as he got older.
Yeah.
Dad was a farmer though. He
Mm-hmm.
always did work that was way, 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 way too heavy for a guy
Okay.
his size.
Yeah.
He was always lifting things too big. He had 4 hernias
Oh
in his
my.
lifetime. And when dad would get really overworked, you'd hear it.
Mm-hmm.
You
That's
would definitely hear
interesting.
it.
Okay.
Um, but it was not something either he or his doctor ever really worried
Mm-hmm.
about.
Okay.
So
Interesting.
some people can have them and it's not because the
Yeah.
valves, if the valves don't close all the way, you'll get a
Mm-hmm.
little whistling sound as
Yeah.
blood escapes through them. And that's what that other beat is. It's that little whistle sound.
Gotcha. But sometimes it just like doesn't affect cardiac output or like efficiency
No,
enough.
the amount of blood that regurgitates back to the atria is so small,
Okay.
it's not of any consequence. Now, if
Gotcha.
dad ever wanted to run marathons, it would
Mm-hmm.
have affected him, probably.
Okay.
He never
Interesting.
did, though.
Yeah. Gotcha.
Where's
Okay.
Emily?
I don't know. Do you want me to text her?
Can you please text her? I
Yeah.
want to make sure she gets in on the fun here. Wow. Stocks went up 540 points.
Yeah.
Yeah, that's a big jump.
Okay. Well,
Do you have any stocks yet?
not yet.
No, when you have a retirement account, you will. When you become
Okay.
a PT and you get
Yeah.
a job, they'll give you a 401k or something like that, and it's
Yeah.
invested. You'll become more interested in those things.
That makes sense. My dad is really interested in stocks, so we've like talked about it a little bit. Um, but yeah, I have some money in an investment account that we are gonna invest in like ETFs and stuff, but we just haven't sat down and done it yet. So
Oh, okay. Okay. Yeah. Well,
no, very minimal about stocks.
yeah, when I was your age, I could have cared less about the stock market.
Yeah,
I was too concerned with passing physical chemistry.
that makes sense.
Yep.
Emily said she can't make it today, and she emailed you earlier about it.
Let me check here. Oh, there it is. Oh, anxiety, panic
Oh,
attacks. I didn't know that.
I didn't either.
Okay, well, make sure when you say your prayers tonight, you include her.
Yeah,
I
I
didn't know she
will.
suffered from those. And I'm
I
betting it
didn't
took her a
either,
lot of courage to
actually.
tell me that.
Yeah. Oh,
Um, well, this will be recorded, so we'll give her the link to it. I'll put it on
okay.
my the YouTube channel so she could watch it. Let's see. Um, too much junk. All right. Hematopoiesis. You have any questions about that?
I think I was just gonna ask, do we need to know all of the specific cytokines, or do we just need to know like how
The ones I
cytokines?
mentioned, you need to know. So
Okay.
erythropoietin,
Yeah.
colony stimulating, macrophage colony stimulating factor, and then the granulocyte macrophage stimulating factor.
Okay.
Sorry, granulocyte colony stimulating factor G, CSF, and then colony macrophage colony stimulating factor GM, CSF, and then thrombopoietin,
Okay.
erythropoietin. Your book mentions interleukin 1 and 3
Mhm.
and MGF1.
Okay.
MGF, those are very general. They don't really have any specific factors. They just tend to tell the stem cell to grow,
Okay.
and they tend to promote development of pretty much all the lines, so they're not very specific.
Okay. So you said GCSF,
G,
GMCSF?
right, GCSF, GMCSF, thrombopoietin, erythropoietin.
Okay. Cool. So know
Um,
those and what they do.
if you do any work with athletes, you'll probably come across a product called Repo. Have you heard
Okay.
of Repo?
I don't think so.
It's recombinant erythropoietin. Athletes use it to cheat.
Okay. Gotcha.
So, in fact, Lance Armstrong used it to cheat.
Mhm.
It raises your red blood cell count
Okay.
and it gives you an unfair advantage in aerobic sports.
Gotcha. So it, like basically like, because doesn't like training at a higher altitude raise your red blood cell count too? So it like kind of mimics that,
Temporarily,
but you can just take it.
temporarily, if you take Repo, it's more sustained, but
Okay.
it's very dangerous and increases your risk of blood clots.
Okay. Gotcha. Um, so when you were talking about like a higher red blood cell count can be a sign of dehydration,
Yeah,
um, how does how does that work then kind of when you're training at a higher altitude? Um, I guess does that just raise your count but doesn't really change the percentage of red blood cells to like plasma or
um, when you train at high altitude, your blood volume stays the same,
mhm.
but the hematocrit percentage of red
Mhm.
blood cells will go up, even though
Okay.
the volume stays the same. If you're
Okay.
dehydrated, volume goes down, and
Oh, gotcha.
therefore hematocrit goes up because the percentage of RBCs
Mhm.
goes up. So you won't
Okay.
have any signs of dehydration if you're training at high altitude.
Okay. That makes sense.
Way to tell that would be to
Mhm.
look at another number in the CBC. There's a number called the mean
Mhm.
um, mean cell volume, the HCV. If you're making cells really quickly, they'll be small. The
Okay.
MCV then will be really tiny compared
Uh-huh.
to somebody who's not training at high altitude.
Okay. Interesting.
Yeah, those CBCs are really useful.
Yeah. Gotcha. Okay. I think that was the only question I had about
Do you have any questions about the lymphatic system?
No, I don't think so.
Okay.
The only one I had was the extrinsic and intrinsic pathways in blood clotting regulation. Can
All
you
right.
go over those again?
Sure. So the extrinsic pathway
Hmm.
is in the cases where the damage occurs usually to capillary beds and tissues,
Hmm.
and you have a protein that's on the surface of cells in tissue that's released called tissue factor.
Okay.
Tissue factor will bind to clotting factor 7.
Okay.
When it binds to clotting factor 7, it becomes active.
Okay.
Tissue factor sometimes is called tissue thromboplastin. You'll see that term in books
Okay.
sometimes.
Gotcha.
When factor 7 binds to tissue factor and it becomes active,
Hmm.
it will then cleave factor 10, and that
Okay.
activates factor 10.
Okay.
So it's due to damage usually outside blood vessels. That's why it's extrinsic.
Gotcha. So the tissue factor is what is becoming active, right? So it binds to the clotting factor.
Tissue factor binds to factor 7.
Right.
That complex now is an active protease.
Oh, gotcha. So like the whole thing together. Okay.
Tissue factors on the surface of cells gets released when cells are damaged.
Okay. So are the clotting factors basically just like kind of, because you mentioned they're soluble in the blood, so they're just like floating throughout the blood, and then when it comes into contact with the tissue factor, it'll bind and cleave factor 10.
Yeah, yeah.
Okay.
They're made as inactive precursors
Okay.
called zymogens.
Hmm.
They're only active when they're proteolytically cleaved. So
Okay.
they're, say they're this long, they get clipped, and now they're this long.
Okay.
That activates them. So the zymogen is a inactive precursor.
Okay.
It only becomes active when you clip it into a shorter form. That shorter form is the active form.
Okay.
The intrinsic pathway is for damage inside a vessel.
Okay.
Damage inside a vessel. So the vessel, when it's damaged, the blood will now be exposed to collagen, which surrounds the vessel and supports it. That collagen is charged, and factor 12 binds to the collagen, changes conformation, becomes active, then it cleaves factor 11. Factor 11 is activated, cleaves factor 9.
Mhm.
Factor 9 now, in combination with factor 5,
Hmm.
and calcium and phospholipids forms a complex called the 10-ACE complex that cleaves factor 10 into the active form of factor 10. Then 10 clips prothrombin to thrombin, thrombin clips fibrinogen to fibrin, fibrin self-assembles into the long filaments that reinforce the platelet plug.
Okay. Gotcha. So factor 12 binds to the collagen, and then that cleaves factor 11, which then cleaves factor 9. And then factor 9 does what?
Factor 9 forms a complex with factor 5
Okay.
and calcium and phospholipids, and that complex cleaves factor 10.
Okay. And then factor 10 clips the
Prothrombin
prothrombin. Okay.
into thrombin. Thrombin is a very active protease when
Okay.
it's activated.
Okay. And then the thrombin is what clips the
Fibrinogen
fibrinogen
into fibrin.
into fibrin. Okay.
Fibrin then self-assembles
Okay.
to form the little cable-like proteins
Mm-hmm.
that reinforce the platelet plug. And there's that picture in your book that shows
Mm-hmm.
you the cells that are all within the platelet plug. You see those
Yeah.
fibers.
Mm-hmm.
You see them?
Yeah.
That's what fibrin looks like.
Okay.
So that's why I used the analogy that the platelets make the brick wall,
Mm-hmm.
the fibrin makes the mortar that
Right.
holds the bricks together.
Yeah. Okay. Okay. That's really helpful. I was getting confused with all of the like factors on the intrinsic pathway.
It's complicated.
Mm-hmm.
It's complicated. And then my farm class, you actually learn about the drugs that inhibit it.
All right. Taking that next semester, so.
Yep. So you get to revisit this.
All right, good. That'll help cement it in my brain. Okay. That's helpful.
Then clots get dissolved by this protease called plasmin. Plasma is
Okay.
made as a precursor called plasminogen. Plasminogen is clipped by thrombin, actually,
Okay. Gotcha.
to form plasmin. Plasmin dissolves clots.
Mm-hmm. So what triggers your body to produce the plasmin? Like how does it know when to dissolve the clot?
Plasmin is produced when endothelial cells have a clot up against them. Those cells now start to secrete something called tissue plasmin activation factor,
Mm-hmm.
which is abbreviated TPA.
Okay.
That's the stuff that you give to stroke patients.
Mm-hmm.
You have to give it to them within a 20 to 120 minute keyhole to
Okay.
dissolve the clot.
Gotcha.
You can also give it to heart attack patients, but the
Mm-hmm.
keyhole of time is much, much narrower.
Okay. Gotcha. Interesting.
That activates plasmin.
Mm-hmm.
Plasmin dissolves the clot.
Yeah.
You ever heard of this phrase D-dimer?
It sounds familiar, but I can't say I know what it means.
If a patient has a lab result that says their D-dimer is high,
Mm-hmm.
when plasmin dissolves the clot, the products are called D-dimers.
Oh, okay.
So that tells you the patient has had a lot of clots.
Gotcha. Interesting. How um how much time is that still in your system basically after you dissolve a clot?
It gets secreted, well, it gets metabolized by the liver.
Mm-hmm.
It doesn't really get secreted by the kidneys. It has to be broken down first.
Mm-hmm.
So it's broken down by white cells. So it gets broken down kind of slowly.
Okay.
So it stays in your system a while, a
Okay.
couple weeks.
Okay. Gotcha.
But it's levels peak. Its levels tank.
Okay.
It goes down slowly.
Yeah. Gotcha. Those were the questions I had written down, but
Okay.
what were things that you wanted to touch on or make sure I know?
You know what end-diastolic volume is?
And diastolic. Oh, I just went over that one. That's the let's see. Diastolic is it's the amount of blood in the ventricles right before they contract.
Yep.
And that you want in cardiac rehab, you want that number to go down, right? Because you want the heart to tighten up.
In heart failure, the ventricles dilate. So
Okay.
EDV goes way up. That's a sign the heart's getting worse.
Really? Why does that why does them dilating mean it's getting worse?
Because now the heart is starting to dilate. You're not getting cardiomyocytes now are starting to get replaced by scar tissue. So now you have a big ventricle.
Oh, okay.
Only part of it that contracts, but
Uh-huh.
it fills more, so it has to contract more forcefully. So what does it
Okay.
do? You increase the cardiac muscle, but you don't get
Mm-hmm.
compensatory increase in the blood vessels. So now as that cardiac muscle increases, portions of it become ischemic.
Oh,
Now you're at
okay.
increased risk for ischemic heart disease.
Gotcha. Interesting.
You want to, the dilation, that's called remodeling, cardiac
Mm-hmm.
remodeling. You want to decrease cardiac remodeling. You want to prevent it.
Mm-hmm.
That's what rehab will do,
Okay.
and
Gotcha.
certain drugs as well.
Okay.
Stroke volume, what's that?
That's like the amount of blood that you're like the volume of blood your ventricles or that come out of your ventricles when they contract. It's like how much blood
Yep.
is it pumping into your systemic circulation?
Yep. What's the ejection fraction?
Shoot, it's really similar to stroke volume, but is it the I know a normal ejection fraction is like 2/3, right? And is it like the fraction of the end systolic or end diastolic volume that gets ejected?
That's a good way to define it, yeah.
Okay.
Yeah, that's exactly right. Good.
Okay.
And normal is in the mid to high 60s.
2%. Okay. Yeah.
Oh, who was that cyclist? I can't remember his name.
Mm-hmm.
He got banned because he was doping. Darn it,
Was
what
he
was
the
his
one that
name?
won like 3 like Tour de France's or something like that?
I think he was on Armstrong's team.
Oh, okay. I just
Um,
remember Armstrong.
Floyd Landis.
Oh, okay.
Floyd Landis apparently had an ejection fraction of something
Mhm.
like 78%
Whoa.
or 80, something just ridiculous.
Yeah.
The guy had a heart that was a diesel engine.
Uh-huh.
Um,
Does it get dangerous at all if you get too high of an ejection fraction? Do you want like a little bit
um,
of blood left in the ventricles, or I don't know.
Not really,
Doesn't really matter.
not really. It would go up to that when he was exercising.
Okay, gotcha. And then come back down like at rest.
Yeah. Then end systolic volume, what's that?
That's how much blood is left in the ventricles after they contract.
There you go. There you go. Okay. You seem to be on top of it all. So
Okay. Good.
if you don't have any more questions, then
Yeah.
I'm good if you're good.
All right, sounds good. Just we have an exam next week, right?
Yeah, I believe we do. Yeah.
Okay. Is
I need
that
to check the schedule. I think we do.
okay? Is that I can recheck the schedule too. I think it's in my planner. Um, do you know what chapters that's
Yeah,
going to be
the
on?
10, we went to 9 last time. We 10, 11,
Yeah.
12, 13.
Okay. Gotcha. Okay. So then, are you covering chapter 14 next week?
I'd like to, yeah.
Okay. Cool.
13 and 14 very much go together.
Okay. Yeah. All right. I think other than that, I'm all good.
Okay. How much longer do you have on quarantine?
I'll be back next Tuesday. So,
Good, good. You feel
yep,
all right?
a couple more days. Yeah, I feel fine. So,
Good to
which I
hear.
actually had it before school started. So they were like, you have to quarantine because I didn't actually have a positive test, but I had like my mom tested positive and I had the same symptoms. And so they were like, it's really unlikely that you'll get it, but you still have to quarantine. So, but
Okay.
yeah, that's all right. It hasn't been terrible. So,
Yeah, okay. All right. Then you take care and I will see you
yeah.
Tuesday.
All right. Sounds good. See you
All right.
later.